Hello, Facebook family. No, this is not the Lone Ranger. This is Pops here with our weekly Pops Health and Community Tips for the week. And the reason I got this Lone Ranger thing, Harry over here behind, we try to social distance a little bit um, because I'm in my vehicle. Had some technical difficulties. I need to call on my guru, Mr. Harry Underwood, to straighten them out. So always here with my integrative health partners, New Horizons Behavioral Health, it's Andrea Winston, and Tree of Life Healthcare, Reverend Dr. Lola Clyde, with Dr. Keita Pitts sitting in. And I'm going to turn this phone on or down so I won't be bothered with that noise. And guess what? We've got some real exciting news for you. We have a special guest, Dr. Stephen Cooper. He's going to tell us all the things he has been doing and all the things that's on the cutting edge of making you and me feel joint-wise feel good. It's really exciting. So what I'm going to do now, part of the technical difficulty is that I can't show the slides and speak at the same time. So I'm going to have the slides shown. I'm going to read them. And as long as we have the good doctor here to explain about all that marvelous stuff that I can't talk about, you're getting news. And this is what we call edutainment. Because on Pop One's Community Health and Community Tips, we have a whole bunch of fun. We act out, but we give you some good news. And so the Lone Ranger is going to be leaving in just a minute. And my Intano over here, who is Harry Underwood, is going to put the slides on the screen. And the good doctor is going to talk. But Andrea, before we go, say something about yourself, as we always do.
Pops. Good morning. Good morning, everybody. Again, I'm Andrea Winston. I serve as the CEO for New Horizons Behavioral Health, and I'm always happy to be here. This is a lovely, wonderful-looking group of educated people that are willing to share their resources so that at the end of the day, we can all feel better. So we're getting ready to go into the holiday season, and Thanksgiving is coming up. So we want to take a minute and rest and refresh ourselves so we can return to the forefront of the war. And the war is about our health and fighting those things that would diminish our health. So we're here, Pops, and we're ready.
Pass it off to good old Susan, and Susan's got the blue. Susan with the blue glasses on.
Yeah, there you go. Good morning, Facebook family and friends. Just want to say I hope everybody is enjoying this beautiful weather we're having in Columbus, Georgia.
Yes, ma'am.
This is a great time of year to be living in West Central Georgia, and hope everybody is getting ready for a safe and healthy Thanksgiving. And even though we may not be able to gather together, we still have a lot that we can be thankful for this holiday season. So happy Thanksgiving, Facebook family and friends.
And Dr. Nikita Pitts. Dr. Pitts? Sure
Good
can.
morning.
We got you.
Can you hear me okay? Okay, good morning, everyone. Again, I'm sitting in also for Pastor Clyde. So good to be here, and I feel doubly blessed because I am kind of representing both along with Dr. Cooper. I worked with last year or early this year before the pandemic hit. So hopefully we'll be able to get more information out to you, whatever, or at least for the our viewers. But I appreciate being here, being able to sit in, and again, thank you to Dr. Cooper for my experiences there at the office. I miss you all. And as far as the Thanksgiving season goes, you know, every day is a day of thanks. And, you know, especially now more than ever, we can look back and see that so many are less fortunate than us. And that's one thing that just kind of keeps us going, all that we can do for others while we are still here on this earth. So again, thank you on behalf of Tree of Life. I'm appreciative for the
and now we have our special guest again, Dr. Stephen Cooper. Let me tell you, Facebook family, he has gone through some travail with computers and Apple and all the stuff I don't understand just to do this good presentation for you all. So the only thing is I'm going to have to operate the slides, and Dr. Cooper, you just let me know by saying next slide when you want to go to the next slide, okay?
I'll be all ready. I can't believe you.
And would you introduce yourself, let everybody know your dual locations, where you're at, hours of operation? Because Nikita, I went to the office one time, didn't know that they were open, stood out there knocking on the door. Probably someone thought I was a burglar. So would you let them know your hours of operation too, Dr. Cooper, so they know where all the good services are that they can come to? So Dr. Cooper.
Will do. Dr. Stephen Cooper. We're at the Phoenix City Spine and Joint Center here in Phoenix City, Alabama. We have the South Atlanta Spine and Joint Center up in Forest Park, Georgia. We also have 2 medical clinics in those locations and a surgery center up in Atlanta. And we're open from 8:30 till 1 and from 3 o'clock until 6:30. And during the holiday here, we're Monday, Tuesday, and Wednesday. Those are our hours. Normally we close at 2 o'clock on Tuesdays and Fridays, but holiday weeks we stay open to cover everybody during that time period. You were talking about the weather. My sister just sent me this, and she was talking about, oh my goodness, what it's like to be here. So just, all of us are fortunate. She's in Detroit, and I was just a-rolling. And then, of course, Pop said, we're going to do this. He said, he's going to take us to the mountains to do this today. So he headed for the mountains. He's going to sit in the car, and I guess we have to do all this where we work at. So that's not fair. We're ready to go.
And Dr. Cooper, I was just looking at my calendar. My Focus on Health show for February. Because I want to get you onto my TV program, because Facebook audiences, I am so excited about all the things that Dr. Cooper is doing presently. I mean, it's just marvelous for those of us who suffer from arthritis or the joints and whatever. And he's going to, and Dr. Cooper, I want you to do that new surprise that you just told me about that got my heart pumping up and down and get me all excited about what now Medicare will be able to pay for, and the services that you can do for so many of us who suffer from arthritis. So now you just let me know when you want me to go to the slides. I will read the slides, and then you just let me know when to go to the next one, okay?
You can head to the slides, and what I'll do is I'll tease that towards the end. The beginning slides should sound relatively familiar, and then we'll go into some things that are a little bit different to kind of add some flavor to the day, and then we'll wrap it up talking about what's coming.
See, Dr. Cooper's a man after my own heart, because I like to keep those teasers to last. That way people stay on. They don't just click on, I wonder what the teaser's all about. So, okay, Harry, we can go to the slides now, so. Thank God for Harry Underwood, the computer guru. Go, Harry. Go, Harry. Go, Harry.
Indeed. All right. So then let's go to. There we go. And share.
Let's go to the first slide, Harry.
And let's go to the first slide.
There you go.
Oh, yeah. I think you're on
slide.
There we go.
That's
Okay,
fine.
doctor.
Here we go.
Phoenix City Spine and Joint Center. Phoenix City Joint and Rehab, South Atlanta Spine and Joint Center, South Atlanta Joint and Rehab. So that's both of your offices.
Correct. We have a total of 5 clinics. They're in 2 different locations. The office up in South Atlanta is about 9,000 square feet. And so it's divided up into those 3 different subsets. And the one here is around 5,000 square feet. And so each office is around 2,600 square feet, the chiropractic and the medical office. So in fact, we just added a C-arm chair, which allows us to do hips and other procedures here in the office here in Phoenix City that we couldn't do before. So in fact, that came in about a week ago.
So you're doing hips as well, doctor?
Oh yeah. Yeah, this is going to be a fully operational, functional procedure room for a lot of different things here that we'll be talking about a little bit later. So you lead me into where I'm trying to go at the end. So we're going to go to the next slide.
He's trying to rush you.
Okay, go. We're at the next side where it says focused on helping.
You be the best you can be. That's right. Yeah, I think it's important. I think a lot of times you see these things and people are always talking about, you know, they show these images. You can be this and you can be that. You know, each of us have the best that we can be. I often get patients that will come in, they say, listen, doc, I've got to get in shape. I said, you know what? You're already in shape. There's all kinds of shapes. There's oval, there's square. You just figure out what shape you want to be in. The thing is that we all have a place that we got to be, right? So we want to help you be the best that you can be, not some fictional thing. You know, you lived your life, right? And you've had your ups, your downs, your physical challenges, highs and lows, right? Some of these things you will carry with you through life. So where the best that you can be may be different than somebody else. So our job is to figure out what's the best that you can be and get you to that, and not have you hitting your head against some fictional, you know, area out there for you to try to claim that maybe your body can't physically, you know, get to because you've had a knee replacement or whatever it may be, right?
Yeah.
So there's certain things.
And it's about realism, because you trust me, they can give me $1 million and say, Pops, I want you to dunk this basketball. I'm gonna have to tell them keep the money. That's the bottom line. You want them to be the best as possible for them to be.
That's right. And the first thing we do is we have you buy a trampoline so you can get up there. But you know, we just gotta see what we gotta do to help you to get to where those things are.
There we go. There we go. You just let me know when you want me to go to the next slide now.
Oh, you can go to the next one. Yeah, you can go to the next one. This next one will be kind of quick because the first one just shows the Phoenix City office from the outside and what that looks like. And then the very next one after that shows the one up in South Atlanta. So nothing exciting there. So just
now the next slide
show those two offices.
Now the next slide shows chiropractic care. According to the Association of Chiropractic Colleges, chiropractic is a healthcare discipline which emphasizes the inherent recuperative power of the body to heal itself. That's awesome.
See, we were born with everything in us, which we like to call innate in the chiropractic profession, that you have something within you, God's expression, in order to heal you from the inside out, right? When you scratch yourself as a child, you don't have to tell your arm to heal. There are properties in there to help you to heal, unless there's something else that's happening outside the norm, right? We have within us everything we need to heal us. The problem is that the things that we've consumed, the environments we've been in, the things that have happened to us, many times we break down, destroy, or block some of our body's ability to express its own healing capabilities. A lot of it, unfortunately, happens in the gut, our digestive system, which doesn't allow us to get the things that we should be getting, and then we wind up with deficits. But to make a long story short, if we can get the body to function the way it needs or should function, you're going to do better and you're going to be healthier. And that's what the root of chiropractic is about.
All righty. You want to go to the next slide?
Yep.
Physical medicine.
And from that, it goes to physical medicine, and that's our sister offices. We have the chiropractic office, the physical medicine office, to allow us to get to some of those areas that go beyond. And we use some different types of things. A lot of folks have gotten injections. So I had to get a knee injection. They got a steroid injection. That uses something called dexamethasone. That's a steroid, and it will decrease inflammation. It will decrease pain, but it will also increase your blood sugar and your blood pressure. But it's one of those side effects, which means this is something that it does just as good as the things you want to do, but it's just something that we don't want to happen, right? It's a side effect. Right. But we use something called Serapin. It's a natural product, comes from the pitcher plant, and it will also decrease inflammation. It will decrease pain, but it will not raise your blood sugar level. It will not increase your blood pressure. So we use the things we need to use to not only get the same functional result, but to do it without creating the negative side effect that some of the other drugs may do. So, and that we work side by side to do that.
Well, I like that. I like that. That goes to show that you're actually thinking outside the box.
Mm-hmm.
Okay. Yep. Now I'm looking at arthritic knee, shoulder intervention.
Correct. That leads directly to half of the teaser. The other half is coming up here a little bit in regenerative medicine. But, you know, when we talk about arthritis, the term just simply means inflammation of a joint, right? We have fluid in the joint. We have something in the joint that shouldn't be there. And because of it, and it sounds kind of paradoxical or opposite, right? Arthritis means, we have joint inflammation. However, typically the result is that the proper fluid isn't in the joint, and you wind up with bone on bone grinding and, degeneration of the joint. There's different types of arthritis. You have rheumatoid, you have osteo, and then there's some other ones related to other types of diseases as well. But when we talk about either a use it or lose it arthritis, which is osteo, or rheumatoid, which is the body attacking itself, what we've got is something going on inside the joint that begins to break the joint down, and now the joint doesn't function like it should. How do we get the joint to function properly? One of the things we do, and I'll talk about this one first and the last one last, is to put space, to get the proper fluid back in the joint. And we do something called, it's a long word, viscosupplementation. Basically, it's putting a neutral fluid like a gel back into the joint, so that now it's like putting WD-40, if you will, to get that joint so it's moving again. And that lasts up to 6 months at a time. And a lot of people can avoid some surgeries with that when it's done properly. Now, a lot of places do it. They don't do it the right way. And folks say, well, it didn't work for me. We've had a pretty good success with it because there are some things you're supposed to do first that most places don't do, because they'd rather do the surgery, to be quite frank, and they skip the other steps, and it's not as productive for people. We don't do the surgery. So our goal is to make it work. That's all we got.
Right.
So we want to make it work. So that's our focus, a little bit different.
And doctor, I was really impressed when I went there. I think I told you I was floored by all the technology that you have. Can you talk a little bit to our viewing audience about how I know the equipment that you have. I don't know the name of it, but I know it allows you to really see, and this is what I like. This is really what I really liked when I came on the tour. It allows the patient to actually see that the injectable that you're putting in is actually going into the right place.
Right. It's the CR. I mean, it's a $60,000 piece of equipment that you typically won't see in a small office or in this type of a setting, because again, the focus is to get to the next procedure, but we want to make sure it's right. And for most people, for a lot of people, and I think research says nearly 30% of all injections that are done in the joint never get in the joint because the needle doesn't get into the capsule, and because the doctor just does it, he's sitting there, he just takes it, does the injection, right? And then if the capsule's torn, then you can inject the medication in. It'll just leak out and go right down the leg because there's a hole in the capsule. But we can go in, and because we're looking at it through this device, we can actually see the dye stay inside the capsule. So one, we know we're in the capsule, and two, we know the capsule's not torn. If either A, you're not in the capsule, then they keep going to their end, and two, if the dye starts to go down the leg, then it's a whole different treatment protocol first to heal the capsule before you ever get to the next step. But for a lot of folks, they just get the medication and say, oh, it didn't work. Well, it just went right down the person's leg because there was a hole in the capsule. So no, it didn't work. But that's not the medication's fault. We did not do the process to make sure that this was a viable time to do this particular procedure on the patient. So we do the C-arm and arthrograms. We've got digital X-ray systems, and we're actually adding a few other devices that they're putting in here as well, so we can monitor and look at what's going on inside the knee. We're all in on making sure that what we do is effective for the patient, rather than just trying to get the patient moved along to the next step. And that's kind of where our focus is, and that's why we are getting the success right now that we're able to get.
Well, let me tell you something. That really impressed me when the young lady took me through and she explained it, because when I saw it, it looked like something out of Star Trek. I was waiting for Mr. Spock to show up. But that was, you don't have to tell me. I could just look at that piece of equipment, and I knew that was more money, more money, more money. I knew it was expensive. You want me to go to the next slide?
Yeah. And the next one is
PRP and regenerative health.
Yeah. Now, here's what's neat, and I'll probably get into a little bit here, because this is the thing that there are people all over the city that go to some of these clinics. They're paying $5,000 and $6,000 and $7,000 to get amniotic and regenerative medicine done on their knees and on their shoulders, and the money they're paying for it because this is the best thing since sliced bread, and it is. To be honest, you've been hearing about the COVID thing, the one that's really saving people, the one all that is PRP. You're taking really regenerative medicine. You're taking the plasma from other folks, spinning it down, and re-injecting it, the stem cell, so it works in this person's body. We know it works. They use it for cancer treatment. They've been using it for years. They know it works on knees, but there's been all the research behind it hasn't hit home yet. And so insurance doesn't cover regenerative medicine, and but people want it. Well, we have just concluded the first trials of it, and right now Medicare is covering some of the amniotic injections now in our office. And we're finishing some of the training up for our docs. We've already done some patients, have already seen phenomenal results from the ones that have gotten it. There's a certain protocol to it, and we're still establishing all our trends and everything. So next time, we're going to go really in depth about what it is, how it works, and what it does. But I'm excited. I'm excited. This is something that I've had seniors come in that have gotten it done other places, and they said it didn't work for them, and we went through it, and sure enough, they had a hole in their capsule. So they paid this money, got this stuff put in, and it just went outside the knee, and so they got $5,000 down their leg. So there's a way to do this stuff the right way, and it's not quick, it's not easy, but you can do it the right way. And so we're trying to go through the protocols and make sure we do it the right way so people get the right results. And we're excited about what we're seeing.
And this is the cheese that we were talking about, because normally something like this here, Medicare didn't pay for. Is that correct?
That is correct. Very much correct. And this is something that is, when I say it's live, this is a live football.
Doctor, let me tell you, I'm just so excited about, as a senior, when you live a long life, you're going to have problems, and we call it arthritis, arty, or whatever, and it does limit your quality of life. So being able to have something like this done that will allow you to be able to enjoy life with your grandchildren, and then my wife and I's case, our great grands, something like this is just awesome. I mean, it's just really awesome that you and your offices are on the cutting edge of something like this that will add quality of life to so many people.
Thank you so much. I'm excited to be able to offer it and what we're doing and what we're seeing. And, a lot of times we have in our mindset that, we got arthritis because we did something bad, or we shouldn't have done this, or I shouldn't have done that, whatever. Look, you live your life. And if you enjoy the results, and, I played football, and so, did you enjoy playing? Yeah, okay. Then, hey, you know what? You got out of your joints what you want to get out of it. There is a price to pay, but there should be a way to manage that so you can still enjoy your life and do the things you want to do and still be able to have the life afterwards. And that's really the focus of what we're trying to focus on, is to do things so that folks are able to still enjoy, and encourage them to keep going out and enjoying, to stay in motion, to keep doing things, the exercise, the working out, the doing the things that they want to do. I don't believe that it's, put yourself on hold and sit on the couch and somehow you're going to get better. The body in motion stays in motion, and when at rest stays at rest. And we got plenty of time to sleep once we're dead. So let's keep it moving.
And Dr. Cooper, another thing that I like when I came into your office is the fact that you really tailor make, because I'm really bad when it comes. I'm good when it comes to faces I recognize, bad when it comes to names. The young lady's name started with M. Melinda.
You're talking about Melanie.
Melanie.
Melanie?
She really took the time, and what I noticed is that you really do an initial workup on individuals when they come in there. In other words, you really spend some time in tailoring and knowing about each individual patient. She took me in so many rooms, I got dizzy. And so I like that. I like that centering in on the totality of the person once they come into your office, and sitting down and speaking with them, because that involves the patient in their own care. They feel like they're vested with the professional in their own care.
100%. And you really hit the nail on the head, is that if the person doesn't buy into what we're trying to do to get them better, what's the point? I mean, look, we're only going to see you for 10, 15, 20 minutes. The rest of your life is on you, right? The rest of that day, the rest of that week. So you have to know and be involved and buy into what we're trying to do so that the things that happen at home, right?
Right.
If we do something, you do the opposite once you leave, we don't get a total result. So our, when we do our second visit, we give the patient our full evaluation and everything. You get a copy of it. There are some people that form is nearly 18 pages long with everything we did, everything we saw, everything we came up with, and why. We're going over the x-rays, going over everything, so that that person understands what this is and why. And that's important. I think it's critical. Too many times I talk to patients and, well, I don't know why I take this, or I had a surgery, I'm not sure what they did, or how does that happen? We want you to understand and know what's going on with your body.
Right.
It's
and that is why unfortunately, a lot of patients don't know, because the care provider does not explain anything. Okay, I'll go to the next slide. Look, this I like this slide here. IV therapy.
Yep. That I kind of interluded before about the problems a lot of people have where they aren't able to get what they should get out of their body because of their digestive system. I talk to some people, I take 1,000 milligrams of vitamin C a day. I take, so many milligrams of B12. I take this and this and that. That's great, and you should, but if your digestive system has an issue and you aren't digesting certain things properly because you've got a problem with your liver, or a problem with your gallbladder, a problem with your pancreas, a problem where you're not getting certain microbes into your intestinal tract, especially the small intestine or the lower end of the stomach, the duodenum. If those things are not getting what they need to get, you can't break down foodstuffs like they should, which means those minerals aren't getting into your body. So you can take 1,000 milligrams of vitamin C and your body's only getting 200.
Right.
So, well, I take vitamin C alone. Well, are you taking it, and I'm taking iron. Well, if you're taking iron without vitamin C, it doesn't matter, because your body needs vitamin C in order to absorb iron. Well, I'm taking that together. Well, are you taking the rose hips, the things that go with the vitamin C, because your body needs that to, there's a whole system. Yeah, it's an ecosystem. And if that ecosystem is disturbed because you've taken antibiotics or something else, which now upset it, then you can't get everything into your system the way you think you should get. So you live your life maybe with not enough selenium, or not enough this, or not enough that. They're depressed because your body can't absorb it. So what IV therapy does is, here are all the vitamins that you need to recover from this, or here's all the things you need in order to maintain your immune system, and here's all the things you need for this, and it's going directly into your bloodstream. So you're getting 100% of everything that's on that bottle, because they don't have to worry about the digestive system.
And it's the most direct route.
Absolutely, it's there. In fact, I did one on Friday. In fact, I did it live. I did a little video thing and did it while I was getting it done, because I worked out crazy all last week and I could feel it. And I said, I'm gonna go ahead and get mine done on Friday so I can recover and be ready to go. Because as your body breaks down and muscles break down, you got to replace stuff.
That's exactly right.
Yeah. So this is one of those things. So you can
I'll go to the next slide then. It says auto trauma.
Auto trauma. Now we're starting to the interesting thing for today. I was talking about this. We've been seeing a lot of this. I don't know if people were getting out finally from COVID, but they're just running into each other. I mean, we're seeing all kind of stuff happening out here today. It's crazy. But, auto trauma is interesting because accidents take place, and so many times people tell me, well, yeah, I was in an accident last year, but I wasn't hurt. And, my comment is always, was metal dented? I said, yeah, okay. Which one do you think is softer, you or the metal, right? And I'm so, okay. Well, I don't know. So, but I was only going, 5 miles an hour. I said, that's fine. I want you to run 5 miles an hour right into that wall, and you tell me if that hurts you, because we kind of don't understand what acceleration and deceleration does to our bodies, right? We don't understand what G-forces do to us, and it does a lot of different things. And so I think, go to the next slide, if you will. I think I've got a little picture there of an acceleration, deceleration injury. Yeah.
Right.
And there are so many things that take place in that one photo. I got one that breaks it down. I'll talk about one. The next one kind of breaks it down and shows you some things, but that just talks about the neck. Understand that because there's a problem, it doesn't mean that you're going to hurt. Okay? The body is extremely good at covering up things so that you can do what you need to do. What's the first sign that you're having cardiovascular problems, major cardiovascular problems? A heart attack. So
Right.
what happened between the time it started and the time you had a heart attack, right?
Right.
There were things going on, right? The body will do what it has to do. So you can go to work, so you can play with your family. It doesn't mean that there's not a problem there. And one of the first things we see is as that neck goes forward and back, it stretches the ligaments and you lose something called your cervical lordosis, which is the curvature in your neck. That curvature that's in your neck is what protects your discs in your neck from getting pressure put on them. Your discs aren't meant to carry pressure. So there's a disc in between each vertebra, in between each bone, right? So if you look at that slide, you see that red square there. It's trying, the red splotch there is trying to show you where the ligaments have been torn or injured in that person's spine. Well, now, just like if you were to take a big pin, you bend it and it doesn't go totally back to straight. Well, that's what happens in the neck. Now, the weight of the head is coming straight down on those discs and they bulge. There's a great study. It comes out of the, it was one of the British medical studies that we did a project on. This is back some 25, 30 years ago. And it said unequivocally, you cannot herniate a disc in your neck until you first change the cervical curvature. You lose your cervical curvature first, and then you herniate a disc. So we spend so much time dealing with, oh, I have a disc that herniated in my neck. Okay, well, first of all, we had this issue first. Well, my neck didn't hurt before. Just because it didn't hurt doesn't mean it wasn't a problem.
That's exactly
your body
right.
covered that problem. The weight kept bulging the disc. Then something happened, the disc herniated, and now you have a problem. So we want to go back to the cause. And when we can get to this before it hardens, we can get to it early enough, we can stop some of these other issues from happening. The next slide is pretty interesting because I think I put a little picture that said fish in a fishbowl.
Right.
We actually have a neurology, we have a neurology group that comes here, and
that looks like that. What I remember in
Yep.
nursing school was a coup contre coup, something like that.
Yep, that's it. That's it. We see it all the time now. We're watching football games. You watch guys collide, and
Right.
they're pulled out for a concussion. These are two men running into each other, maybe going 5, 6, 7 miles an hour, but yet we somehow believe I can go 20 miles an hour in a car. Another car's going 10 miles an hour.
Right.
And each car is weighing 3,000 pounds, and we don't think that we got hurt. I don't understand. Look, what it's trying to show is this: if I take a fish bowl and I have a fish in the middle, I can move the bowl and the fish stays in the middle, right? So, but if I move the bowl really, really fast, I can hit the back or the front of the fish in the bowl. The fish didn't move, the bowl moved so fast. In our bodies, the brain is sitting in fluid. And our head, when we get in an accident, we say, oh, our head went forward. That's not really what happened. The head sits still, and the car either moved forward or the car moved backwards. And it moved all the way back until finally either the seatbelt caught it or the back seat pushed it forward. At that point, once the head went forward, the brain was still sitting still. And boom, smashes into the back of the skull. Then the head looks forward, and then the head looks back, and boom, smashes into the front of the skull. And when we bring people in here, we have this thing on the wall. I know, Nikita, I know you've seen this on the chiropractic side. We've got all these little stickies. It has numbers and letters on it. And I have people touch alphabet numbers and A and 2 and B and C, and then they're going like this. And all of a sudden, they stop and they've lost where they're at. They can't track anymore. I've had women sit there and just break out crying. Men stop and just, where was I? They aren't able to focus on two different planes at the same time anymore.
Right.
It happens all the time. What do you think happens on the football field? They think they were normal, but yet they're not 100%. And here's the thing. Why is it so important we catch this concussion? It's not the first one sometimes that gets you. It's not knowing you had the first one and you take the second one. Now we've got some major long-term issues. Yeah, so they come in here, and then there's another type of concussion that doesn't affect the brain. It's the inner ear. A lot of people forget, that inner ear, which controls, your balance and all this other stuff. That thing is sitting in fluid as well, and that thing can really take a blow when the airbag hits your jaw. It rattles the inner ear, and now this person's hearing tingling or noise, or there's all these things that take place, and people just go and say, well, I had an accident, it'll go away. You had a concussion. It needs to be evaluated, and we need to get you to the right professional so they can be treated properly. Well, I had a CT scan, it was negative. A CT scan will only show a concussion if you have bleeding on the brain. When two football players crash on the field, do they go and take a CT scan of them, or do they do a neurological test?
Right.
It takes brain trauma to show up on a CT scan. So there's things that we've tried to find. Go ahead.
And I'm glad you brought up about the middle ear, because that is just as sensitive, and a lot of people don't realize that they can be traumatized by damage to the middle ear as well.
Oh yeah. There's a lot of it too. There's a lot of testing that goes on just with that creates a lot of issues for a lot of people. You can go on to the next one. Yeah, some people get tinnitus as a result of that. It's
that chink, that ringing in the ears.
Yeah, and it's I mean, they're talking about people committing suicide with tinnitus being bad enough. It's
right.
Not, it's something very difficult to deal with. Proper intervention means not just going, oh, you hurt your neck, you hurt your back, then we'll do that. That is so 1960. You know what I'm saying? We need to evaluate everything, look at everything, determine not only how this affects you physically, how this affects you other ways as well. Look at long-term and short-term effects, and then determine what needs to be done. And every one of our patients that we do, they're getting a chiropractic, they're getting a medical. Many of them from there are also getting, whether it be a neurological or orthopedic, just depends upon what we're finding. But we will chase it down until we understand everything that happened to that person. And that's really what it's all about.
And yeah, you covered the many types of concussions.
Oh yeah. And I have some people come to me and say, well, I don't have an attorney yet. So that's fine. Come, let's look at you, because, there are some that are really, really good at understanding these things and some that aren't. And I'd rather just get you so we can make sure we get you to the right person, because there's a lot of confusion around that. MUA, manipulation under anesthesia. Probably time-wise, we'll probably end up talking about that. I don't know if I really got a chance to talk about this before too much. But this is something.
No, in fact, that caught my interest, because I haven't heard you speak about this yet.
Yeah, MUA is something that when I was actually hired by the military to start the military chiropractic program back in 1995, 96. I was out at Fort Benning for a couple of years, and there was a group of doctors there that were coming from Houston, Texas, that were doing MUA. And when I finished my portion of the project in 97, the first thing I did was fly down to Houston and took about a month just to train and get certified in it. And I've actually trained and certified several doctors here in Georgia, but it's the reason why I own the surgery center up in Atlanta. MUA is, let's say you've had a surgery on your knee, or you had a bad car accident, or you had a mastectomy. You cannot bring your shoulder all the way up. You can't straighten your knee out. You can't straighten your elbow out. There's all these things that you functionally have lost range of motion because of scar tissue. You've got muscles that have become so constricted or contracted that they will not open to release. Because of the injury, you've now created some sort of psychological muscle memory where the body is trying to protect the joint so much it will not let you release it. By putting the patient under anesthesia, and we have an anesthesiologist that does that. Of course, those muscles relax. We can then break up the scar tissue, break up and stretch out the contracted muscles, begin to work some of the tissues while the person is asleep. It'd be way too painful to do when they're awake.
Right.
And then, if there's anything else that needs to be done to the patient, sometimes there's other injections done for the neck or whatever it may be by one of our other surgeons, one of the doctors. Then they're brought back up and they have full range of motion again. They're able to move their arm again. They're able to straighten out their knee again. It's amazing. And patients come out and go, like, oh my God, I don't believe this. I've been to do this in months.
Now, I never heard of that. When I saw it just now, it really caught my attention. But that's something else that's pretty much on the cutting edge as well, because a person could not stand the type of manipulation if they were not anesthetized.
Oh yeah, we've had some Blue Cross Blue Shield before they became Anthem. The other Blue Cross Blue Shield of Georgia. Used to be very good at taking care of fibromyalgia patients this way. We used to do a ton of them. And we've got some that never have to go back and take their regular medication when they got done because we have to break up a lot of that. Insurance has changed so much. And as it changes, unfortunately, we have to change how we go about what we do.
Right.
Now, different insurances, Cigna does pay for this, Humana pays for that. It's crazy. Every single one of them has their own take on what they can do and won't do. We do it a lot with auto accidents because, there are things that happen after an accident, sometimes with someone's jaw where they cannot even open and close it properly. And
Right.
trying to do that while the person's awake is just not tolerable. And we can do that through an MUA. So that's,
No.
Go ahead.
Now, doctor, is this covered under Medicare?
That one, unfortunately, is not covered under Medicare. Medicare does have a write-up for it where it does. We do some for work comp. The problem is that you're dealing with a procedure that has 3 to 4 different providers to it and the surgery center. And
Right.
how Medicare reimburses it, it doesn't cover everything, unfortunately.
Okay.
And we've tried it, but
I'm going to go to okay, what I would like for you to do, doctor, because this is really exciting for me as a senior, would you go back to our teaser? And I want you just to explain to our viewing that the fact that this is covered under Medicare is awesome. It's awesome. And I've already got you scheduled, by the way, for my TV show in February. It's the third Thursday in February, and I will give you all the information how to get to our CCG studios. But would you go back to the teaser? Because I think what you told me about prior to the show, for a lot of seniors, is just awesome. That Medicare is covering this.
Absolutely. And if you have Medicare in the secondary, it's covered 100%. And the main thing is that, what Medicare had a question about was the live cells. And I can get deep in the weeds, but I won't. But, there's certain types of things that they can cover and certain types of things that they won't. And so there's been a real big push to try to see exactly what they're comfortable with. And they finally came up with a product that we're able to provide now after it's gone through all of its FDA stuff and everything else. And not only do they cover it for, around the knee or the shoulder, but we can also do it for the back. We can do it for, the neck. We can do it for any tissues that are chronically torn, any tissues that are chronically injured. And it provides the environment for all the factors, all the proteins, all the cytokines, all the things
that's what I'm talking about,
that
right?
particular tissue needs to heal and to become whole again. You always have to use the disclaimer, of course, nothing's 100% on everybody. And that's just the way it is. You get some people that because of surgical intervention, the joint has changed so much that it will not get back to normal. We know that. Or there's been so much degeneration that it cannot. But even in those people, if I can move you 10% better, that may be the difference between you going to the mall and walking and not being able to go to the mall and walk.
Exactly.
And if you can go to the mall and walk, that will regulate your blood pressure. That will regulate, so much of our life and our health is devoted to motion that if you can't go out and perform and walk and do the things you need to do, so many other things from weight gain to diabetes to blood pressure, you can go on and on and on, begin to get worse just because you can't move forward. And so anything that we can do to help people get out and move, to stay active, is critical. Going out to play tennis or golf isn't just because I like tennis and golf. It also keeps you healthier. It keeps you moving.
Exactly. And this amniotic stem cell type treatment is really on a cutting edge, and it will get you to the best shape that you can, the best condition that you can be. And that's really the best that anybody can ask for. What I'd like for you to do, doctor, would you go again, let everyone know where your locations are, your contact information, your brick and mortar, where you're at, where you're located, and your hours of operation. If you can let our viewing audience have that.
Here's the easy part. Okay, Dr. Stephen Cooper, you can go to www.P as in Paul, C as in Charles, Spine, Phoenix City, SPINE, PCspine.com. And there's some videos and everything on it to explain a lot of this, which helps a lot. But we're at 3700 South Railroad Street, right over here by the Walmart in Phoenix City, 541 Forest Parkway over in Forest Park, Georgia, not too far from the airport, about a stone's throw from the airport. And our phone number is 877-495-7773. It's 877-495-7773. And you can reach us either office or location through that. And again, pcspine.com. We'll get you to our website, and we can make everything happen from there.
Well, great. Now I noticed that there was so much information. Oh, look. That's, the only thing that I want to do is the Bible says. Now I know I got some Bible scholars here, so I'm going to head off. My people perish for
lack of knowledge.
There we go. That's what I'm talking about. For lack of knowledge. And so I really wanted everyone, and I'm going to tell you what was interesting. You gave so much information that I know that my community partners, Dr. Pitts and Susan and Andrea, they were latching on to everything. You really did what I wanted you to do. I wanted you to go down. I did want you to dig in the weeds on some of these things, because a lot of people don't realize what a gift your services are really providing. Yeah. Susan, you want to say something?
No, I was just thinking that I need to make a trip over to Phoenix City and have them check out my neck and shoulders for me.
There you go. That's what I'm talking about. But I want to say thank you to Miss Andrea Winston, Executive Assistant of New Horizons, with Dr. Nikita Pitts, representing Tree of Life Healthcare, Susan Gallagher, the blue glasses on. Everybody, I've got so many comments on those blue glasses that you wear every once in a while. And Dr. Cooper, thank you so much for what you do in the community. We appreciate everything. And me with my arthritic hands, my back, my hip, my knees, my toes, and I can get some of that. Give me some of that MUA too. I'll be ready. Hey, look, I'll be maybe feeling like I'm back in the Army when I used to do that 5 miles every day. Okay.
All right. I'm sure somewhere is written in First Stephen's second opinion, you got to get yourself right.
And to our viewing audience, I always say this when we leave. Please be good and kind to yourself, because God loves you. Bye-bye now.
Bye-bye.
Bye. Happy Thanksgiving, everybody.
Happy Thanksgiving, everybody. Happy Thanksgiving. Don't do like me and eat all the turkey and ham and sweet potatoes, because I'm going to do it.
And be safe.